Okay, Miss Karen. My name's Dr. Rodriguez. We talked a few seconds ago and you were telling me your story.
Okay.
Do you mind starting over? Okay,
I had pain, but
Okay,
I only have
one
pain
second,
at
okay.
night.
So, who referred you here?
Crystal.
Okay, and Crystal is somebody on your route.
On one of my routes where I deliver mail at, and we was talking about the pain that we have, and she said that she went to the same type of doctor that I went to, and they told her the same thing I told me, because I refuse. I don't. If I don't have to, I don't want to take no shots in my back.
Okay.
Okay, and she was saying the same thing, and she said she had went on the internet and looked it up, and she was saying what the internet said. Well, you're not supposed to take, I think, 2 or 3.
Okay.
But I had already talked to friends that prior that had shots in their legs and their knees and their feet and all that.
Okay, so you went to the first doctor, and the first doctor
Said, I went to Dr. Shea. Dr. Shea said, okay, well, let me do he checked me, he made me stand up, and he checked my back, and he wasn't putting no pressure on my back. He was just saying, well, where's the pain? So he sent me in for an x-ray, and I went in for an x-ray. He came back out, he said, well, I don't see anything really wrong, but maybe a little arthritis, but I'm going to send you to a nerve specialist.
Okay.
So I went to a nerve specialist maybe about 4 or 5 months ago, and they did the little, I guess that would be acupuncture, because he put needles in my back, and he had a sonogram.
A nerve conduction study.
Okay, so he put, and then he said, well, I hear sounds on the left side, so I don't see you with no nerve disease. I just, maybe if you got pain, it's maybe on your left.
Okay.
I said, okay. So I went back to Dr. Shea. He sent me to a vascular doctor to check my veins.
Okay.
So that come out with something, but I'm saying that my veins were closing at my hip. Okay. And then he sent me to a spine specialist.
Okay.
Which sent me for an MRI. Then they showed me on the TV where he looked it up, and he said, well, you see the little white stuff. I said, do I have cartridge? It moves? He said, no, it's not the cartridge. It's the liquid between your little white bones. And you see right here, there's nothing right here. It's because your nerves are pressing up against it, and the flow is not going through.
Right. So
I want you to start taking shots in your back. I don't recommend surgery, but I need you to take maybe a couple of shots. Go see these guys, which is right next door, and have maybe 1 or 2 shots. I said, well, don't it make you fat? I don't want to get fat because everybody tell me when you take steroids to make you fat. He said, well, no, not when you take shots. I said, well, I done seen people take shots in by the mouth and get fat. I don't want that, but I don't really want no shots in my back because I seen my child go through it. That's a painful thing.
Okay. So the lady on your route said come.
So she referred me to you, and I set up an appointment maybe about 3 months ago, but something happened at work where I couldn't make it. So I was supposed to have an appointment on the 17th of this month. So since I was off, I woke up Monday morning with serious pain, couldn't hardly get out of bed. I called Laura, your reception, and she told me I got something tomorrow morning at 9 o'clock. So I'm here now.
Okay, perfect.